Hello, and welcome to today's episode on Life Saving Aid. Today, we are going to be looking at what to do when a baby is choking in order to help relieve the choking and prevent severe consequences, including death. It's important we know that choking is a medical emergency, and if nothing is done within 4 minutes, the risk of a brain damage developing is significantly high. Also, it's important to note that every 5 days, a baby dies from choking. And this is why what we're about to demonstrate is very important. For babies who are less than 6 months of age, they can choke from breast milk, from formula milk, from balloons, because you see some babies playing with inflated balloons. At times they can be trying to put it in their mouth and it can burst. And when this happens, particles can get lodged in their airway and this can cause choking. So it's important that we remove toys, small objects, and even if babies must play with toys, it should be under direct supervision. Anything that can cause choking should be removed from babies' reach. While for older babies, babies above 6 months to 1 year, the common cause of choking is usually food particle. Okay, and this is why it's important that babies are properly introduced to food from 6 months of age, the right size, the right texture, and the right amount under direct supervision. Now, when a baby is choking, at times you could see that the baby might be making an attempt to cough. When the baby is coughing, if the coughing is effective and is very strong, allow the baby to cough. Most times the cough can dislodge whatever is causing the obstruction. However, when you notice that the cough is not strong enough, is weak, please don't wait that the baby is coughing. You go right ahead to perform the procedures I'm going to be demonstrating in this video. Another way you can recognize that a baby is choking is that when you look at the breathing pattern, it's abnormal. Okay, so you notice that baby is struggling to breathe. Times babies might have bluish discoloration around the face. So what do you do when you recognize that this baby is choking? You quickly pick up the baby, look at the face of the baby. You see that the baby is really choking. Please and please, it's advisable that you get on one knee and perform the procedure I'm about to show you. A number of people can still perform it while standing, but because of the panic the situation can cause, we've had instances whereby baby falls off the hand of the mother or the caregiver at that point in time. And you can see that from this height, if a baby mistakenly falls, the height is significant and it can cause serious brain injury or spinal cord injury to the baby. And this is why it's important that when you pick up baby, you notice baby is choking, you get on one knee. This way you've reduced the height, so that in case of panic, baby slips off from your hand, the height difference is not significant to cause debilitating injury or a very severe injury. So turn the baby face down with the head slightly below the buttocks, your forearm resting on your thigh, the head of the baby facing downward. All this to stabilize the baby to prevent the risk of fall in that kind of situation. Next, you use your hand to support the head of the baby. You are stabilizing the head of the baby, but please be mindful not to use your palm to cover the nose and mouth of the baby. So your palm to support the baby from the jaw like this. So this is what we are saying. So you see that the mouth of the baby is open and the nose is open. So I'm not trying to suffocate baby with my hand. So we put in this direction and we give 5 blows or 5 slaps to the upper part of the back between the shoulder blade. 1, 2, 3, 4, 5. Please hit significantly. Okay, don't tap. No, you are not tapping. You are giving blows or slap because you are trying to dislodge what's causing the obstruction. You turn to assess the baby. Remember, 5 blows. You see that the baby is still choking. You position baby like this with this hand supported on the other thigh. You give 5 chest thrusts. 1, 2, 3, 4, 5. You turn again. 1, 2, 3, 4, 5. You continue. 1, 2, 3, 4, 5. You keep this circle going until the choking is relieved, or until emergency medical services arrive, until you've gotten to the hospital. Please, when you notice a baby is choking, as you're trying to pick up the baby to help the baby relieve the choking, also activate emergency medical services or put a call through to someone that can be of help. And if you're at home, you raise an alarm. Baby is choking. Honey, please come. That way, in case the choking is not being relieved, you make your way to the hospital immediately. I hope this video helps someone out there. Share this video so that together we can help reduce the number of babies dying from choking every 5 days.